Hello, good afternoon. Welcome to the Roadmap to Peer Support webinar. Thank you all for joining us today as we introduce this new resource. My name is Hanan Aboumatar. I am an associate professor of medicine here at Johns Hopkins School of Medicine and direct the Center for Engagement and Patient-Centered Innovations within the Armstrong Institute for Patient Safety and Quality. As we start off this webinar, we have an opportunity to poll everybody on the line in regards to the role that they have. We're gonna go ahead and ask a question that you can respond to, and it basically pertains about what your role is, whether you're a community-based organization leader, healthcare administrator, healthcare professional, patient, family member, researcher, or other. Please hit your role, and then this way we can share in the next 5-10 minutes the results of the poll, so you can all know about the participants in this webinar. So the Roadmap to Peer Support is a resource that has been designed to provide guidance for a variety of audiences on how to build and maintain a peer support program. Peer support programs help connect people who are dealing with similar health challenges with other peers who have dealt with like problems. This roadmap can be helpful to healthcare and community leaders, researchers and program developers, healthcare and public health professionals, patient advocacy organizations, patients, family members, and other caregivers. So to start with, we're going to go through an overview of the roadmap, how it was developed, and what it includes. We will then move on to a panel discussion where we tackle some of the key issues pertaining to running a peer support programs with our panelists, and then move on to take your questions. As we talk, if you have some questions coming up, please write those under the Q&A window in the WebEx platform, and then hit submit. We will review the questions as they're coming in, and we will attempt to respond to as many as possible at the end of the webinar. You may want, once you send your questions and answers, to X that part of the WebEx, so this way you can minimize that window and see the slides on your larger screen. So to start with, I want to start by acknowledging all our project team and all our project partners and advisors. This has really been a wonderful journey together for us over the past 2 years to get us to this point. We have a large team with diverse perspectives and wealth of experience. We have included the names of our team members with a little bit of information about them in our team directory, which you can access on the roadmap pages. We have also included a section that details more information about our peer support program partners as well, and we're going to talk a little bit more about that in a little bit. We also would like to acknowledge all our partner program leaders who have provided generous support for this effort, including time to help us reach the key informants within their programs. Also want to acknowledge all the key informants who agreed to be interviewed and shared their valuable time and perspectives for this work. And last but not least, we would like to acknowledge and thank our funder, Picori. Without their financial support, we could not have done this work. Also special thanks to our core team members who have worked on data collection, analysis, and authoring of the roadmap. Lee, Jin, Erin, Tom, Joan, and Chris. It's really been a privilege and pleasure to work with all of you. as well as all our larger project team and advisors on this project, and the names of our project team and advisors are listed here. Sorry, I'm having a bit of delay in moving my slides here. Yeah. To access the roadmap, we have created a short web link for you that is available on this slide. You can see it's bit.ly/peer support roadmap. We have also included a citation that you can use whenever you need to reference the information that you pull out from this resource. Okay, it works. All right. So to start with, here are some key terms. In this particular roadmap, we are concerned with peer support amongst individuals and families struggling with similar health problems. Granted, peer support programs are everywhere. There's peer support for students, professionals, people struggling with various social and economic circumstances. This particular roadmap is geared more to the support amongst people struggling with health challenges. Here are some key terms. What we mean by peers are two or more people who have lived-in experience with a similar health problem or challenge. Peer supporter is a person who has personal experience with a health condition, who has received the training in some way and is supervised or supported in a manner that allows them to provide support to others. A program leader, for the purposes of the roadmap, means the person who manages the day-to-day operation of a peer support program. And a healthcare professional is a person who is qualified through education and training to provide healthcare services. So just briefly, for those of you who are not as familiar with what peer support may provide individuals, a peer supporter can provide practical information and advice about managing a health problem and how to live with it. This type of information and advice that stems from experience with the health condition can rarely be provided by healthcare professionals who don't have the experience with that problem. Peer support can also bring in hope and less isolation for the patient or family caregiver, may provide insight about what may lie ahead. Sometimes a person just needs somebody to listen to them and understand what's happening to them, and a peer supporter provides an excellent candidate, an opportunity for that. Peer support also helps normalize some of the feelings that a person is going through as they tackle their health problem. And sometimes that's all what people need, is that to know that what they're feeling or thinking is not that they're gone crazy, but really it's something normal at that stage of the problem. Also, peer supporters can provide information about available services in the community that can help people as they attempt to manage their health problems. So why did we embark on this project? There have been multiple studies that have been conducted on peer-to-peer support among various populations struggling with different types of health conditions. And those studies have shown that peer support can help people cope with their health problems, adopt effective self-care behaviors, and achieve desired improvements in physical, mental, and social and psychosocial outcomes. Peer support services, unfortunately, are not available for all people who can benefit from them. It is quite the exceptional circumstances when a provider has the ability to refer a patient to a peer support program. And part of that is that we need much more research to understand how to build and sustain peer support programs and how to tailor them to the needs of people with various health conditions. Um, to be able to do that, we also need to demonstrate impact on health and well-being so that larger organizations and healthcare systems are willing to fund these programs as well. However, thinking through that, we thought, well, there are peer support programs that have been thriving within healthcare, within community settings as well, and why not attempt to learn from these programs in our effort to advance the research and advance people's abilities to have more peer support programs running in real world settings. So we sought to partner with a diverse group of peer-to-peer programs that have gained national attention and been sustained in non-research settings. These programs had to provide support to patients and family caregivers or both, and they had to provide support that involves either face-to-face or telephone support. And they also had to be led or co-led by peers, meaning that programs that were entirely healthcare professional-led were not included in the program. And when I mean by healthcare professional-led, I mean the peer support itself, the delivery of support to patients and caregivers. We therefore identified 7 peer support programs, 3 healthcare-based and 4 community-based programs, and we chose those for the diversity of the populations that they serve and the various delivery settings. This table depicts the partner programs: NAMI, Parent Connection, Cancer Survivors Program, Parent to Parent USA, Weight Watchers, Stanford Healthcare Peer-to-Peer Program, and these place. And as you can see, these programs represent support services, provide support services for a variety of conditions, from mental illness to helping new mothers, to helping cancer survivors, to helping parents of children with disability, helping people manage their weight, helping people who are attempting transplant, and people with a variety of GYN cancers, as well as helping people with who are trying to recover from substance abuse problem. We followed a staged approach to developing the roadmap, starting off with working on learning from these 7 peer support programs, holding key interviews with key informants within the program, and then conducting data analysis and synthesis for what our findings are. Then we held a workshop in which we discussed the roadmap development. We shared the information from the qualitative research that we had conducted in the first year of the project, and we conducted roundtable discussions to agree on main roadmap features and key competencies for peer supporter training. Then we moved on to develop the roadmap and pilot test the peer supporter training and got additional feedback within our larger team and partners and with participants from the workshop that we have held. And then we refined the roadmap accordingly. And then we moved on to disseminating the roadmap via established networks within the partner programs and within our organization. And then we are here now, holding the webinar about the roadmap and working on papers describing the results of this work. As part of the first year in the project, we have conducted 43 interviews with key informants from the partner programs, including leaders, peer supporters, group facilitators, and program participants. And then moved on with the analysis of the interview findings to discuss those and work together to develop the roadmap. Throughout this 2-year project, we really have followed a partnership approach, seeking perspectives from all our team members, partners, and stakeholders. We had ongoing conversations, and we followed an iterative process for roadmap development. Along the way, I believe we had all had the opportunity to learn from each other, especially given the diversity of the partner programs, and further our collective efforts to strengthen peer-to-peer support. In the roadmap, we organized the work involved in starting and maintaining a peer support program into 4 parts. And you can see those 4 parts, which for many of you who work with improvement efforts within healthcare are quite familiar with the approach of thinking about planning, implementing, assessing, and sustaining. And you see in bullet points there some of the topics that we tackled in the roadmap under each of those areas. And in the interest of time for this webinar, what I will do is particularly lead you through the key sections from the first 2 parts, the plan and implement sections. And so as part of the planning for starting a peer support program, one would want to start by assessing the need for the program. And this is particularly a good time to start talking with stakeholders and engaging them in that process of program development. One would want to know more about the organization and the community the program is planned for. And we have some strategies in the roadmap about how you could go about talking with stakeholders within your organizations and helping with securing some buy-in. There's also some initial decisions that one would want to be thinking about at that early stage. For example, where would the program live within the organization? Who would run this program? How would key parts of the funding be handled for the program, as well as how the peer support itself would be provided. Are you thinking, for example, about a group format for providing peer support? Would it be a one-on-one type of connection between a peer and a peer supporter, or would it be both? And in the roadmap, we discussed the benefits and the challenges and limitations to each of these approaches. And also within this section, we talk about some of the potential challenges that people who want to start a program may meet. And it's important to think about those challenges ahead of time, because then you may build in some components within your plan so that you can tackle those challenges as they arise. So for example, we have included tables that include benefits and limitations of various approaches to delivering peer support, whether that be more guided approaches, more flexible approaches with peer supporters, as well as things like one-on-one support versus group support. And all of these approaches have their place in the real world, depending on the type of the program that you're thinking about, the scope and the health condition that you are tackling, and the setting in which you are providing this program. When we're thinking about implementing a peer support program, one of the important aspects to think about is the people within your program and the policies and procedures that those people would follow. And thinking, for example, about the people in the section of implement in the roadmap, we talk about extensively about the program leaders as well as the peer supporters, and then spend some time talking about how you build relationships with program participants. And we'll discuss that a little bit in the panel session as well. For peer supporters, we included specifically more information about how one could provide support for peer supporters. And this is very interesting because peer supporters do have their own needs. And therefore, the program has to be designed so that you can support people, peers in the program who are attempting to support others. We have also focused on thinking about the core skills and competencies for peer supporters. For example, we've included ways by which peer supporters can receive support within various programs, and all our partner programs in this project had very clear structures by which peer supporters can receive the services that they need. But there's really a wide range of ways by which people can support peer supporters, and that can vary according to the funding, the context of the program, and the setting in which the services are being delivered. Um, in terms of core skills and competencies for peer supporters, um, we've recognized that peer supporters need a certain set of core skills to prepare them to successfully provide peer support. And some of the people are more intuitively prepared to do this than others. Also, some people with various education backgrounds may be particularly well positioned to do this better than others. However, with proper support and training and guidance, you make sure that all your peer supporters team are up to speed. And thinking about how people may prepare peer supporters to deliver effective peer support, one could think of a general skills to providing peer support, as well as specific skills that are going to be dependent on the health condition that is being addressed and the people that the program is intended to serve. So what we did in the roadmap is that we focused on the general skills for providing peer support, but granted, you will need to think about the specific skills that will be different according to the program and the population that you're serving. And in the roadmap, we list a set of core skills and competencies that we have got together based on the interviews that we conducted, as well as a consensus process throughout the work that we've done with our program partners and larger project team. In addition, in the roadmap, we have materials that we have that you can use to help you help your peer supporters develop those competencies. So what I'm going to do next is go ahead and show you the roadmap, and okay. And so you can see this is the front page of the roadmap here, and you will find the information about, okay, I'm sorry, I have to share my screen with you so that you would see what I'm doing here. And thank you, Vance. Okay. And so, okay. So you can see now, okay, Vance is giving me the thumbs up that you should be able to see the live page now, and you can see on the left-sided menu that we have different sections, including a section on resources and tools, a section on program partners, in which involves description as well as stories of about how these programs have started and some of the challenges and lessons learned along the way, and some success stories that you might find particularly informative. There's also a section about our project team, and then there is a button here where you can communicate with us in the future and tell us what you think and if you wanted to connect. And so if we were to click on the resources and tools, it will get you to this page, and on this page you have a listing of the various tools that have been provided here. And most of these tools have either been developed by the project team or are courtesy of the partner programs that have been gracious enough to share the tools as examples to help you develop your own tools and customize them for your own needs. And so you have a list here of the types of tools that we have included. And then you notice that there is a little form here that you have to fill out so that you can go in and download the tools. We have included that in particular. It's a very simple form so that we can capture the impact of the roadmap, which allows us to further our efforts and continuously work on this. Certainly, we want to make sure whether the resource that's out there is something that is being used And so we have, so going back, yes, yes, yeah, I think I got it. All right. And so can you see me now? Okay. So I'm going back to share my screen here, and there we go. And so can you see now back the slides? Oh, because I'm sharing something else. Got it. All right. And so now we go back, and really when you fill that information, you see a nicer table, but this is really a black and white version of it, of the type of the different tools. And as you click on any particular tool, you can download the file, whether that be a Word file. We try to give you Word files as much as possible so you can adapt them to your needs. You will find little superscripts next to each tool indicated which program that tool was provided from. Okay, so with that, I want to go ahead and move to our panel discussion. We are very happy today to have with us 4 of the partner program leaders whom we've worked with over the past 2.5 years now. Lily Shockney, who is our University Distinguished Service Professor for Breast Cancer at Johns Hopkins University and the Administrative Director of the Johns Hopkins Breast Center. She's also the Director of the Johns Hopkins Cancer Survivorship Programs. And John Forte, who is currently a healthcare consultant and has been the Administrative Director for Patient and Community Engagement at Sanford Healthcare and Clinics. She's the founder for the peer support program at Stanford that who is a partner on this project. And we also have Christine. Christine Sweeney is the program manager for Parent Connection at Beth Israel Deaconess Medical Center, and Kate Fahrenholt, who is the executive director of NAMI, Maryland. So thank you so much, panelists, for joining us for this discussion. I want to go ahead and start our conversation by asking Christine a question specifically about providing peer support. Christine, what must a peer supporter do to successfully support other peers? And from your perspective, what do program leaders need to have in place to make sure peer supporters succeed and ensure a positive peer support relationship within the program?
Okay. Can you hear me? Hello?
We can hear you.
Oh, good, because I was having trouble being heard, but great. So I actually want to flip that question around to start with. It actually begins with the program leaders communicating limits and boundaries with the peer volunteers, because in order to really understand the role, what I do at Beth Israel Deaconess is we really are clear about their role as a mentor. And you had mentioned before that some people come to this with professional background and experience, and some people don't have any professional. And sometimes we find it's the professionals that have the hardest time distinguishing, switching into the role as a mentor. So for example, I'm a mental health person. I'm not going to be doing mental health counseling in the role of a peer supporter. And especially coming from a medical center, because sometimes our volunteers are nurses or have some medical background, that their role is not to provide medical advice. And especially working in a medical center, we have to be very clear with our volunteers on the boundaries of that, because often what our mentors are doing are giving people permission to contact or letting them know that they need to be in contact with their medical providers. So it starts at the outset with our extensive training with a clear statement around boundaries and role. We also talk very clearly that helping the volunteers understand the sense of professionalism and that they are an extension of a standard of excellence that we hold very high here at the medical center, and to remind them that often people's last sense of the medical center is in the last person they talk to. And for us, that's our volunteers, because we're calling parents after discharge from our postpartum unit. So helping the volunteers have a sense and understanding of the standard of excellence, that also translate to sustaining volunteers as well, because if they feel a part of something, then we keep them for longer. I think that said, one of the most important things that volunteers need to be able to do in connecting is not to come at it as one more expert, but the most important qualities we look for are empathic listening skills and an ability to put aside their own story in order to first hear where the patient or the client is coming from. Oftentimes it's really easy to get blinded by our own stories when we're talking with someone who are going through very similar situations that we went through. And so one of the things that as program leaders that we have to be careful about is screening people to make sure that they have resolved any issues that may have come up, and so that those issues don't transfer into the relationship that they're having with a new patient. So it takes assessment, it takes some insight on regards to our volunteers to really make sure that they can put aside their story first and listen, and then when appropriate, use their experience. But that we talk a lot about helping them understand the focus of the relationship is on the patient, that it's always kind of hearing and responding to what's going on with them, and for the volunteer using their experience to support and guide what may be going on with that particular person at the time. I think another thing I would say, in addition to the initial training around boundaries and supporting volunteers, we have an open access. Volunteers have my cell phone number, they have my program coordinator's cell phone number, so essentially we're available to them 24/7 because
Right.
we know they get calls from patients on a Saturday morning, and it may be an urgent issue of a baby who is not breastfeeding and suddenly is not having enough of a wet diaper output that they should be having, and so we really need to make sure that they contact their pediatrician. So, you know, I let volunteers know that I don't want them to wait till a Monday morning at 9 o'clock to call me. If they have an urgent question or concern, they have access to me generally 24/7. And I think that
Right.
sustains our mentors to really hang in because they know that they're not alone.
Right. Great.
Am I close to my 3-minute?
Yeah, I wanted to give an opportunity to Kate to weigh in before we move to the next question, and Christine will help us answer that as well. So, Kate, based on your experience and perspective on this, other things you want to add to what Christine was saying about the ability of peer supporters to successfully provide peer support, and how could you set up the program so that it facilitates that and encourages positive relations between peers, among the peers within the program?
Well, there's so much to say, and I have to say people should definitely look at the toolkit because there's an amazing array of really important pieces there. I think we made a choice to have a very certain model. It grew, and then it became our model. Actually, our model is relatively structured, but we are entirely run by and for peers. We have, over the years, developed a lot of toolkits that cover how people are trained, how they are recruited and screened, not only job descriptions, but making sure that when they're screened, they understand what they are signing up for, and that we understand that they really are going to be able to play a peer role. In our trainings, we do a lot about giving people skills training around communication skills and how to remember that the group is not about the facilitator, and it is not for the facilitator, that one uses one's personal experience only as a method to get the other peers to really be talking to each other. And the same thing goes for when it's one-on-one. We do a lot, and we never do enough of making sure that we're providing all the possible support that those people we train and send back to run support groups or deliver courses, that they're really getting all that they need. We're always under capacity, but it is very, very clear that both the trainers, who are also peers, are available, as well as the program coordinators. And even myself as an executive director, I know the programs, I've been part of the programs, and so I can respond to a request for help. We do a lot of stressing fidelity to the model. We have a very clear model, and we train people around that model, and we send them back saying, this is what you're going to do. And then we do have methods by which we can, if we find that our peers are not perhaps doing things entirely with fidelity to the model, there are not only options for refresher trainings, but there is also the option for decertification of the person, usually with a requirement that they take the training again. And then one last thing is that we very, very, very much stress and do skills training on how to manage urgent or crisis situations, or even the mentioning of the topic that might be something that lights up or triggers intensity in one of the peers. For example, when you talk about someone disappearing and the person who's talking about it is not, it's all done, it's been gone and done, it was 5 years ago. We train our facilitators to recognize that and then to help the group deal with it. And that is all.
Thank you, Kate, so much. And Kate, your program is an example of a much more guided and hands-on approach to supporting peer supporters, and you will see that in our table. You will see that there's this big range in terms of how much guidance and structure you want to provide peers. So great to hear your perspective on that. So moving on to our next question, and my next question, I'm hoping, Joan, you can help us tackle, and that is, what do program leaders need to keep in mind when working with peer supporters and peer mentors? For example, what are some of the benefits and challenges that you would anticipate peer supporters may experience, and what strategies may help maintain their motivation, well-being, and engagement in program activities?
Thank you, Hanan. Well, we find that our mentors are often people that have a lot of gratitude. They're grateful to the people and organizations that have helped them through difficult times or provided care, and so they really want to be able to give back. And they experience a lot of satisfaction in being able to help other people. And I think for many peer supporters, it allows them a way of making sense of something difficult that's happened in their own lives and doing something meaningful with that experience. We know also that when they act as a peer supporter or mentor, it helps them continue to process that event in their life. And as they continue to kind of build their own strengths and insights, they're really sustaining their own recovery and enhancing their own health as well. In training, we provide a lot of guidance to develop new skills, and so they develop their communication or relationship building toolkit. They can get much better at those things in all aspects of their lives. And they become a part of this kind of ongoing community and often establish friendships with other peer supporters or peer mentors who have had common experiences. And finally, we see also that it really helps the peer supporter by helping someone else to build their own self-esteem and confidence. And often people have had that shaken during their own health experience. As you mentioned, there's definitely some challenges as well. Sometimes there are communication issues. A lot of times there are very sensitive or difficult subjects. The mentor can be unsure of kind of how to engage their peer, or they may find that they get frustrated because they're trying to reach them and feel like they're not successful. They may feel the need to be continually available to that mentee or to the peer. And for that reason, we try to make sure we give them breaks from their role. They may have their own demands in their family, or may not feel well, or may need support themselves. Sometimes peer supporters are also fearful about having to revisit difficult or traumatic periods in their own lives. And you know, that is part of mentoring, is sharing some of their own experience. And it does sometimes occur that painful memories can come back up and trigger these unwelcome emotions that the peer supporter will have to kind of work through again. So it can be really important that we provide, I think it's really critical that there is support for these peer supporters to keep them safe and healthy, as well as engaged and motivated. Sometimes we actually lose a peer or a mentee. Maybe that peer chooses to end the relationship. They may backslide, they may become sicker, or they can even die. And so you can imagine that for the peer supporter, that can cause quite a bit of emotional distress and grief. So we want to make sure that every program has a clear plan for supporting mentors during these times of emotional distress and where they're feeling these challenges. There's lots of different ways that we heard in these programs to provide that. Maybe events designed for them to get support from the other peer supporters and talk about their worries and their challenges, or maybe even just social events where they can connect. And that can even be on social media. Some programs use a more formal buddy system where they peer people and ask them to look out for each other. And as has been mentioned, just making sure that you have some sort of clinical psychological support for these mentors, these peer supporters at times when they are experiencing difficulty.
Great, great. Thank you so much, Joan. Christine, did you have something to add on those lines?
In general, what I'd like to add is some specifics about what Joan outlined, and some of the things that we have found very successful to supporting our mentors is that we send out survey monkeys, surveys to any of new parent who's participated in our program. At the end of the time, which is a 12-week mentor relationship, we send out a survey monkey asking for specific feedback. And whenever we get feedback, and I have to say I'm a little proud that we get pretty much 100% across the board excellent feedback regarding the relationship, regarding the support that they received from their mentor. We actually reach out and share those SurveyMonkey results with the mentor so that they can actually see. I think sometimes the challenges of being a mentor is that patients may not be able to articulate how supportive they felt by you and the impact of the volunteer's role. And it's typically in the SurveyMonkey that we give patients an opportunity to really talk about what the experience meant to them. And our volunteers so much appreciate when we reach out and share, because sometimes they feel like, you know, the phone calls that they didn't really do much, or that the new mom wasn't really struggling and they just talked about how much she loved her baby. And then we can share a survey result that actually says, gives a volunteer a much greater appreciation for the impact that she actually had. One of the challenges that in our program, because it's a phone call connection only, our mentors provide new parents weekly phone call support to the first 12 weeks, so they never actually get to meet in person the patient that they're providing support for. And one of the frustrations that our volunteers can experience from time to time is constantly leaving voicemail messages and not hearing anything back, or having a very poignant first phone call where they, you know, spoke with a mom who was in tears the whole time and then not being able to reach her again for 3 or 4 week times, or you know, having 2 or 3 phone calls and feeling like they were off to a great start, only to not hear anything. And some of the things that we hear from our new patients is that they so appreciated, they may not have talked with their mentor every week, but they so appreciated the voice messages that she left, and that just knowing someone was out there that they could reach out to if they needed to was meaningful and powerful. And so when we can share that feedback with our volunteers, it really sustains them in recognizing that what they may have perceived as really not doing anything at all was in fact quite meaningful. Another thing that we have found our volunteers really appreciate is we've actually created a Facebook page that's a private Facebook page just for our volunteer group. And we have, at any given time, about 50 active mentors in our program. And while we're very clear about not discussing any specific patient-related concern on the Facebook, it's a wonderful way for them to share resources, such as where's a new moms group or where's a lactation consultant that might be in this particular suburb. But it also provides them a way to connect as moms, and so sometimes people post on Facebook just funny mom things. And so it's another way to foster a sense of community within our volunteer group and a way to continue to keep them connected to the medical center. And that as well, one of the things we used to have a monthly mandatory volunteer staff meeting where our volunteers would come together once a month and really do case presentation and learn from other mentors. We have shifted that. Many of our mentors have young children at home, and sometimes getting to meetings once a month can be a challenge. So we've actually shifted that to quarterly meetings that we give volunteers 3 different days, time options that they can choose from, and they come together. We do 3 different meetings. There's usually 10 to 15 mentors at any given meeting, and we do case presentations, but we also feed them during meetings, and there's a social aspect to that as well. And I think that really sustains volunteers. They appreciate coming into the medical center. Just the physical process of coming in, parking here, coming into the building provides them a sense that they are part of something larger than the phone calls that they're making at home, and they really enjoy that. We also have, within the larger hospital volunteer program, there's actually an annual award that goes out to a volunteer providing service within our OB/GYN program, and it's named after one of our long-term nurses and volunteers, and once a year one of our mentors is actually nominated and receives this award. It's, usually they get a gift card. It's a small monetary, but it really means something that they received this kind of recognition within the larger medical center. And volunteers really appreciate that.
Great, great.
That's some of the
Thank
ways
so
we
much.
get very specific in how we support and appreciate our mentors.
Great. Thanks, Christine, and I think that's really, really important because the peer supports are at the heart of the program. So, and like you said, sometimes, and I think Joan mentioned that as well, that sometimes peer supporters may feel a little bit, disappointed by reaching out repeatedly to some particular peers who may not be as at that moment in time, they may not think of peer support as a priority in their life. So maintaining that motivation is key. Moving on, Lily, I wanted to ask you about if you can share with us some of the challenges that your program have met since it started and how you have addressed those over time.
Sure. So our program is called Survivors Helping Survivors, and it's a peer support program specifically for newly diagnosed women with breast cancer, and we match the newly diagnosed patient to a survivor volunteer based on her age of diagnosis, the stage of the breast cancer, the prognostic factors of the tumor, and her anticipated treatment plan. So it's giving her a mirror image of herself in her future. One of the biggest challenges that we have had is that women can get breast cancer again. Over our almost 22 years of having our program in place, we've lost 13 of our survivor volunteers to stage 4 disease. So not only is it a loss of that individual, but it really does impact the team, and it frightens the team because they're looking at someone and maybe thinking, gee, my breast cancer was a lower stage than hers. I had a higher survival rate, but she now has been diagnosed. And so it brings up the fear factor, and we need to do a lot of psychosocial support for the rest of the team members so that they don't overthink and worry that they may end up being number 14 or 15. We've also had some individuals who, though they wanted to become a survivor volunteer, really weren't ready to yet. And in the interviewing process, as well as doing some role playing, if the individual that wants to take on this new volunteer role starts crying, then that, certainly does tell us that psychologically she's not ready to help someone else because we still need to be helping her. So volunteers need to be at least a year out from completion of their acute treatment. So it may be that that individual needs to be 2, 3, or even 4 years out before she's going to really be able to provide that that one-on-one support. We've also had an interesting challenge in the reasoning why someone wants to join the survivor volunteer team. We may be at cross purposes as to what her desire and purpose is versus what our purpose and intentions are. So I've had some individuals who, when I ask, tell me why you want to be a survivor volunteer, the majority of them are going to say, because I want to do what was done for me, I want to support newly diagnosed. But I've had a few who have said, I had a delayed diagnosis by my doctor, so I want to make sure every newly diagnosed patient has a lawyer, or it'll be some other purpose. And then I try to redirect all of that energy into something that they can be helpful with, whether it be working with another advocacy organization and stomping on Capitol Hill, or doing something else. So I just don't turn them away and say, no, I don't think this is what we need or you need, but instead find something for them where they can be successful based on what they're passionate about. And when passion and purpose come together, extraordinary things always happen. We also have the issue that people get busy, and they may now be taking care of their mother with Alzheimer's or who knows what. Life never stands still. So touching base with each survivor volunteer, a minimum of quarterly, and we have quarterly educational dinner meetings, just to see how is everybody doing, because they may need to go offline for a bit. I never want to stress people out or have them see this as being a job.
Right, right. Thank you, Lily. This is extremely informative, and I always think about that when working with our peers about what you say about never turning anybody away, that everybody has some type of skill set and passion that one could capitalize on, and that can help them on a personal level as well. Joan, do you have additional points to share around the challenges that your program has met and how you've addressed it over time?
Yes, I can really resonate with some of those that Lily has identified, but I'd like to add a couple more, one around matching and the other around funding. So like Lily, we work in a healthcare setting at Stanford, and we work with a lot of less common diseases, and people come from all over the world, right? So we have learned that even though we prefer a in-person model, that's the original model that we developed, we have had to rely on technology for people because of geographical differences, maybe geological also. But also, we have come across populations. We have a very active cystic fibrosis peer-to-peer program, and those folks cannot be in the same room. So they have learned to utilize social media. I think we've also learned not to use a very rigid algorithm when we are looking for matches. Sometimes we have a match with the disease, but not with the demographics of the person, or maybe we don't have the exact disease because it's rare, but we have someone with a disease that shares many characteristics. And we've learned that other things like lifestyle or culture can be very important in the match as well. So we've learned to be much more flexible with great success.
Great.
The other piece I'd like to highlight is funding, and I think that's a question everybody always has. And whenever I talk about Stanford, people think we have deep pockets, and I just want y'all to know that we run this program with a 0.5 social worker. That is the only paid position, and it's quite a good-sized program. So we've had to be very creative. early on I was able to establish a partnership with social work, which was a natural fit in our organization because they benefit so much from this peer mentor program. So we really depended on individuals in executive roles in these departments. We didn't wait for permission. We didn't ask if we could start the program. We actually put together a plan to begin the program with minimal resources so that we could start to demonstrate benefit and outcome because we knew in our organization that was a way that we would be able to get funding. So we utilized grant funding, we utilized temporary funding, we did everything we could to at least get some data to share. So I think it's really essential to have program champions when you're starting, and I think throughout the life history of the program, people that are both well respected within the organization, but also willing to take a little risk because this is new for many organizations.
Right. Thank you, Joan, for tackling the issue of funding. And I know one of our questions that came was about making the case for peer support programs. So hopefully what you've shared helps with that. The last question really is focused on sustaining programs over time. And Kate and Lily, I'm going to ask you this question, with you, Kate, being having ran, NAMI Maryland, and with NAMI having been going on now for 25 years. What do you think have helped you sustain your program to date? For example, any specific approaches or strategies or resources that you believe have been crucial to your ability to succeed and maintain services till now?
Yeah, thank you. That's a big question, actually. I won't talk about financial sustainability, though that is really, really important. And there's good resources in the toolkit, but also I was just previously, the previous question started to talk about that. I think for us, the several things have been very important to sustainability. One is keeping the peer in peer-to-peer. While some of our staff, many of our organizations are not staffed, and they often are run by peers. But in the role of a program coordinator, even when one is a peer, we do make sure that that the staff is there to coordinate and empower the people who are delivering the peer programs, and that's worked very well. We've got thousands of people across the country, and what was very important for us was to be able to have something that was reproducible, and that if someone walked into a support group in one state, that it might be the same as others. That's a decision. That's a decision to be made. When we started, we had, for example, share and care support groups, and that was fine. But we surveyed all our facilitators and a lot of the people who attended and then did not come back, and we found that there were certain things that we needed to make sure the facilitators' skills and boundaries issues, et cetera, that we needed to make sure all facilitators had. Therefore, we developed a structured model and a train-the-trainer model so that we could make sure that all across the country we were having the same effect. One of the things that's very important is making sure, while we're mostly volunteers, we're always struggling with organizational capacity. We are very much dependent on volunteers, so making sure that we leverage volunteers and their contacts that they may not have suggested to us because they're coming to us about mental illness, but it turns out that maybe they happen to be also, a high-level corporate person. We're always trying to leverage our volunteers. We certainly want to sustain our volunteer pool, but it's also about being able to project as you grow or move or just go into the next year. How many new people are you going to need to recruit and screen and train in order to keep the pool that you have, because sometimes there are people who drop out, but also to be able to expand the pool. Finding ways to project the needs you have so that you are providing training and support where it's needed is very important. We also both recruit directly from programs for the people who we're going to train to be peers for the future programs, as well as getting as many of our participants and our program, what we call program leaders, the people who teach our courses or facilitate, helping us to get the stories of the personal experience stories of the people who have taken part in our program and how it helped them specifically, and then using those stories not only to attract new people to the programs, but also to try to attract funding and attention from decision makers. And finally, I would say that for us, because we need to be reproducible and we want to have fidelity to the model across the country, we have a large focus on creating and updating toolkits, not just the content, but the, how to do things. And we always assure people we're going to be training that your core value is your personal experience and that you are a peer, and then everything else is in the manual.
Right.
Right. Yeah. Right. So
yeah.
Thank you.
Thank you very much, Kate. Lily, do you have some additional points on this? I know we're running a bit behind on time.
Sure. I will be brief. We do our very best to make sure that our survivor volunteers are treated as part of our Hopkins family, and they value that. We also celebrate with them regarding not just their next year of X number of years that they are now breast cancer survivor themselves, but when they become a grandmother or when their daughter gets married, or maybe they themselves have gone back to school and gotten another degree, so that we're not just looking at them as in their role, but also treating them as someone that does have a life beyond their volunteer role with us. We hold quarterly educational dinner meetings, which I think are also very valuable, brings a lot of camaraderie around the table, but it also keeps them informed about what's the cutting edge research that is out even before it's known to the public. And always making sure, how is everybody doing? Because there are times in which someone may need to go, offline for a while because they are dealing with other issues, and we always want to respect that.
Sure. And that's great. And just as a reminder, Lily's program runs in a healthcare-based environment, whereas Kate is very much a community-based environment. And you can see that these programs can be sustained over time in various settings. So thank you so much for our panel for this great, rich perspective on some of these key points for running peer support programs. And I want to go ahead and take a couple of the questions from our participants. The first question says, how can a healthcare organization make the business case for a peer support program? And that's like the $1-million question. I think that John has helped us tackle some of that, and you can certainly, this webinar is going to be available for people to view at future times as well. And she had shared some of the things that in her program have helped to make the case at Stanford for continuation of this program over time. We do include in the roadmap a variety of suggestions and ideas pertaining to helping people get the buy-in needed, and really it comes back to being able to demonstrate the value of the program within your organization. So a lot of the conversations around how you assess your program impact and sustain it over time will be particularly relevant for you as you think about making the business case within your own organizations. The second question, panel members, did you want to comment on this response about making the case?
Oh, sorry. Who would you like to
Hanan, this is Joan. I was just going to add, to think about specific data that your organization may already collect. So with our pilot program, we looked at rehospitalization. We looked at things like utilization of the social worker, and we were able to track a reduction in the use of hospital resources, which helped us attain the funding.
Okay, great. Thank you. The second question is about do you do any sort of screening for the mentees? Is participating in the peer-to-peer program open to anyone? And there is a part of the roadmap around the program, peer supporters specifically, and the process for recruitment. And it really is going to depend a lot on the program and the condition you're trying to work with. But and Lily had, for example, talked about if a person is acutely just recently been treated for breast cancer and still suffering from the acute effects of that process of going through the treatment, etc. They may not feel strong enough at that moment in time to take on that role, but perhaps within that 1 year period, they would maybe able to be a wonderful peer supporter. And in the roadmap, we have provided some resources and guidance in terms of some tools to help you, like checklists in terms of recruitment, what you want to be thinking about. There may be some particular flags that make it hard for certain people that you can identify during interview time that make you anticipate that some peer supports may have particularly hard time, for example, with supporting others without being super judgmental about certain people who may not be following, for example, recommended advice. There's certainly components of the training for peer supports that can help address that, but there are some people who may not be able to move beyond having very strong feelings about certain problems that people may be struggling with. So yes, there may be people who may not be appropriate to become peer supporter, the answer is, but that will greatly vary according to your program. And like Lily was saying, we don't want to, you probably want to think about how that particular person may be able to divert their passion and abilities to somewhere else, such as maybe advocacy or being maybe a patient advocate on your PFAC within the organization, but maybe not the best person to support somebody who's particularly vulnerable at the moment, struggling with a particular health problem. Any additional points you want to add, any of the panel members, on this? So we have another question here that's quite interesting about, it says, how about screening mentees, meaning program participants, and can anyone participate? And that is a very interesting question, and it goes back again to the type of condition you're dealing with and the population you're serving. Hopefully, one could think about this as a more of on a longitudinal aspect. So not that a particular person can never participate, but more whether there is particularly good times for people to join a program. And we face situations, for example, if you're providing peer-to-peer support within a group format for a particular health problem, but then a particular participant may be actively suffering from a mental health condition or substance abuse problem that may prevent them from effectively being part of the group, or maybe actually disruptive to the group conversations. That is a situation where you maybe need to provide individual will support for that participant and maybe guide them towards other programs that may be particularly helpful for them. So that's like on a larger scale. You would want to definitely make sure that the people joining your program are not by any means posing potential harm or negative effects on others within the program. And that is the kind of things that peer supporters and program leaders can help facilitate and guide peer supporters on. Always, this one reason also you want to have enough peer support for the peer supporters, because when peer supporters are working with particular participants, sometimes they may be facing particular challenges with that person, and you would definitely want to have a backup, a system by which that peer supporter can go back and say, here are some of the problems I'm facing with this program participants, and what can we do about those? And these programs can be a host of things, anywhere from a person feeling very maybe depressed and posing a danger to themselves, to maybe posing a danger to others, to maybe suffering from major psychosocial problems that they need help with, that the peer supporter cannot help them with. Any other question? Yes. Yes.
Yeah, this is Kate, and I know that we all have there are so many different peer models.
Yes.
But in terms of we have, since almost all of our programs are really group delivered, and we get lots of people who call because they, for example, are a social work student and they want to learn everything about mental illness, and they'll call to sign up for our peer-to-peer family education course or our peer-to-peer relapse prevention course. So there is definitely a screening that goes on, not only to make sure that in every way that the person is truly a peer, because we don't even let observers come in. So there is screening. And the other is that there's also screening for, does this person understand what the peer group they're representing, because they might have several in our area. We might have someone who has depression but is also the family member of someone with schizophrenia. You know, they have to be a peer in whatever course they enter. So there's a lot of conversation with the participant or potential participant about what to expect, so they know what they're signing up for too. I think that's really important.
Right. And Kate here, when she refers to peers, she means people who are struggling with mental health problems or caring for a loved one who does have a mental health problem, and that is a condition of enrollment into their various programs and educational classes. Thank you so much, Kate, for that comment. I'm looking at the time here, and we are past our end of webinar time, and before we close, I want to bring to your attention that Vance had put out the poll results from the participants in the program, and basically we had a large number of healthcare professionals and healthcare administrators, some researchers, some community-based organization leaders, and a few patients and family members, and a group that identified as other roles. Before we close, I hope that you will provide us with some feedback about this webinar. We have a couple of questions about your interest in participating in future collaborations within peer support programs and working together on furthering the ability of organizations to build peer support programs and for researchers to do more to establish the case for the benefits of peer support programs in a more broad and rigorous manner for a variety of health conditions. So please go ahead and respond to a couple of the questions that are in your WebEx as feedback for us. We highly, highly appreciate that. And there are means by which you can also connect with us through the roadmap under the Tell Us What You Think button, so that we can have an ongoing conversation. And finally, I hope that you will help us disseminate this resource to others, so that within your networks you can pass the word around about the existence of this roadmap and tell us over time about how you have been using this roadmap, and if there's particular information that you identified would be helpful for you in furthering your efforts, so we may consider it as we review and revise this roadmap over time. So with that, I want to conclude and thank everybody so much for joining us, and big shout out for our project team and program partners that made all this work possible. Have a good afternoon.